Good evening. My name is Farah Jones, and I am the mental health coordinator in psychological services, and I help to manage the mental health screener along with uh, my director, Dr. Christina Chester. And so I'm just going to go an overview of the screener and the information about it. And then if anyone has questions, we can ask questions at the end. So due to the new state laws, MCPS must uh, conduct a mental health screener with all students eventually, but for right now, we are working with grades 4, 7, and 10. In 2021, the Maryland State's legislature passed the Blueprint for Maryland's Future, which mandated schools to conduct a mental health screener for students. The screener that we have chosen is called the Behavior and Emotional Screening System, the BESS. The benefits of this screener is just a quick screening, 5 to 10 minutes to complete. It's similar to when you take your child to the pediatrician, or if we have our vision and hearing screeners each year. They're just a way to identify if students may need additional behavioral and social emotional support. The screener does not give a diagnosis. This is not a psychological testing. It is generally a screener which can be given by the teacher or a counselor or anyone. It does not have to be a licensed professional. So we use this screener to help us find behavior and emotional strengths and areas of need. Once again, it's brief. It's only 5 to 10 minutes for the students to complete. It is delivered electronically, so they would complete this screener at school using their Chromebooks. It is available in both English and Spanish, and it is a confidential process. So the results, we'll talk more about who has access to those results. The BESS is not used to diagnose mental health concerns. Students' confidential information is not shared with anyone outside of MCPS without parent guardian written permission. As you can see, it is a brief screener. There are 28 questions. This is a sample, and most of the screeners, depending on the grade level. Uh, they use never, sometimes, often, and always, and ask questions about different areas of students' mental well-being. We do have links to sample questions in English and Spanish if you would like to view that in the PDF provided earlier. The benefits is that the results of the screener, if students are shown to be at risk, we will work with their families to provide either school-based mental health services, or if we need to refer them for mental health services, we will work with the student well-being teams will work with the parents to assist them in this matter. So some different things that they may need support with are additional supportive interventions. Once again, it does not have to be from a licensed clinical uh, clinician. It can be the school-based mental health staff like the counselor, assistance for students that face academic, behavioral, and or emotional challenges, and helps us to find students before they develop any suicidal or homicidal ideation. So it's an early identification system. This process is confidential. It is private. Only select staff will have access to student information. Teachers will know the final risk levels, but they will not get individual responses. Uh, Letters will be sent to parents or guardians informing them of the results, and families will be contacted by a school staff member if there's a concern that might benefit from additional support for the mental health. And you will receive letters that will inform you, as well as information on next steps the schools will take to assist your child. If you want to know your child's individual responses, you will have to make an appointment with the school counselor to review those. Results will be shared with our student well-being teams members and a staff in the MCPS district office, which is myself and Dr. Chester, as well as our data uh, team of shared accountability to make sure that we are implementing programming district-wide that address the needs that are found in the screener. Students' confidential information for the screening tool will not be shared with other agencies unless we have your written permission. So schools will send home consent forms along with an information letter explaining the screener. Students cannot participate in the mental health screener without parent guardian consent. So if you do not return a consent form with a yes, my child may participate, your child will not complete or submit and the consent form to the school. The student will not be allowed to participate. And this consent is only active until June 30th, 2026, this school year. We are completing these phases by we are completing these by phases on phase one, phase two. We are in phase two, and you can find a list of the schools that are in phase two. And if you're on this call, you are probably in phase two. We are doing this in three phases because Montgomery County Public Schools is a large school district. So we've had a phase one last year. We have a phase two this year, and we'll complete the screener of all those students in those grades next year as well. The screening window for the mental health screener will be between February 12th and April 30th. Your school will determine the date that your child will complete the screening if you provide consent. Each school will have different dates within this window. If your student has special needs, the schools will work with the students who may need accommodations. Students may be able to either read the questions independently or understand the questions if the items are read to them verbally. Interpreters can be provided to students if needed, and your school staff will provide those if they are needed. Your child's school, when we talk about the results, they will discuss results and possible interventions to support your child. Our student well-being teams are our teams of school staff who work with students who may need support, whether it's academically or whether it is behavioral or social issues. The schools will share the results or the risk level and next steps using a parent guardian letter. You'll receive a letter. Actual answers are going to remain confidential. If you would like to see your child's answers, you may. You just have to talk with the counselor and come in or meet with them somehow to review those answers. So there are three levels that your child will have as a result of taking the screener. Normal risk, your child does not have any concerns at this time. Elevated, your child may have some concerns that we should discuss. And extremely elevated risk, your child may have concerns that we should uh, discuss. This is not a psychological test. This is a screener. Your school will then meet with you, talk with the student to see what's going on. They may be referred to a school-based counselor, but all of that is done with your consent. If you want additional information about this screener or the student well-being teams, which are the teams who will implement this screener, any other mental health resources at your school, or our overall well-being and student services, you can click these links in the PDF. Or if you have further questions, you are welcome to contact myself or my director by calling Psychological Services, or you may send us an email. So that is a general overview of the mental health screener. Are there any questions at this time? You can put it in the chat or you may unmute yourself. And I'll put the presentation in the chat again. Doesn't seem that we have any questions.
Hi Farah, good afternoon.
Hi, how are
This
you?
is I'm good. How are you doing?
I'm well.
Um, Question for you with regards to the screener. I mean, I'd like to have clarity with regards to the about the mental health screener. Is this more of like does that include like social like social issues that the student encounters through the school, such as bullying or depression?
hmm So a screener will show if there are some areas that may need that the student may show where they may have supports needed. However, it is not a psychological test that will say that will diagnose whether there is depression, but it may show that we need to do some more investigating with the student with the parents as well as the school team to see what's going on with the student, which means some parents choose to use an outside agency, but it is not required because it's a screening. It just says, okay, we need to talk about the student more and look at talk with the counselors and the teachers and things of that nature.
Thank you so much.
You are welcome. Are there any more questions? I will stay on for about 5 or 10 more minutes if uh, you have a question. If not, thank you for joining us and have a good evening.
Thank you.
Hi, this is Sunshine. I wasn't sure if you were done with this slides or not. But I guess I wasn't clear on who this information is being shared with.
Mhm. Yes, the information is being shared with the student well-being team. So the student well-being team is made up of typically administration, your counselor, your psychologist, your social worker, your if you have a student with special needs or a student a EML learner, their case managers are part of the student well-being team. And so that information is shared with they will have access to the scores so that they can send results. As far as any other outside agency, there's unless we have permission from you, it's not shared with anyone else.
Okay. And you were saying this is similar to like the questions we'll see when they go to the pediatrician.
Yes, and I'll show you. Let me go back to the sample questions that are on the screener. So if I don't know whether you see my screen?
Yes. Mhm.
Okay, so these are the sample questions that are on there. So I have trouble sitting still. My teacher is proud of me. My parents trust me. I have trouble paying attention to the teacher. I want to do better, but I can't. I am lonely. Those are some of the questions that will be asked. And it's only fourth graders, seventh graders, and 10th graders.
Oh, okay.
Mhm.
So students that are not in those grades will not, is this like an annual testing or how frequently will they be doing this?
As of
Or
right now,
screening, I'm
it's
sorry.
yeah, as of right now, it's every 3 years. As of right now, the state's intention is for it to be a yearly screening, but as of right now, with Montgomery County, we're phasing it in. We are using those grade levels at this time.
Okay.
Mhm.
So they won't, like if I have an eighth grader, they won't get tests or screened until 10th grade.
Correct.
Ah,
But
okay. Okay.
if they
Got it.
participate, if you have an eighth grader, they had the opportunity. Some of them had the opportunity to participate last year, but may not have been part of that. But yes, not again until 10th grade, the way that it's set up at this time.
Okay. Thank you.
Mhm. Are there any more questions? Well, thank you for joining me. I will still stay on the line if anyone else has anything, but you can have a great evening. Thank you.